Hi, my name is Patricia Trong. I will be doing my presentation on obesity in adults. So the public health problem is obesity. Obesity is the imbalance of intake of food. So the public health problem exists in our society. Worldwide, 39% of people that are over the age of 18 are overweight, while 13% of them are obese. This happens because we're just less active now and we eat larger portions of unhealthy foods. This happens worldwide, and it can be seen more heavily related to social economic status, because people that have higher standings in that status are more likely to have a better diet than those that are lower. And also, if you are a child that has obesity, you are more likely to have it when you're an adult. There are three main factors that play into obesity. One is genetics. Genetics tells us how our food is processed, and we process it all differently because of the way our metabolism works. Some people have higher metabolism, people have slower metabolism. The next factor is lifestyle. We've just become more accustomed to being lazy. We sit in desk, we drive everywhere, and we also snack while we watch TV, like Netflix. And our diet, we've just been more used to eating larger portions of unhealthy foods, and fast food has made it very convenient for us to really eat unhealthy foods. The future risk in the community that can happen is people with obesity are more susceptible to heart disease, diabetes, cancers, and Alzheimer's disease. And also they can face a lot of financial stability problems with medical bills, weight loss products, and if they lose a job, they're just not having any income. So the first strategy in order to solve adult obesity is there isn't a very specific strategy to solve it, because you just have to kind of follow traditional ways, like change your lifestyle, eat healthier, exercise more. But the second strategy deals with behavior intervention and education. Behavior intervention is to decrease the negative stigma of actually gaining weight. Rather than being negative about all those things, why not be positive, encouraging? Encourage someone to run. Encourage someone to eat an apple. For education, we want to educate the kids and the families all together in order to help them live a healthier lifestyle. So when it comes to solving adult obesity, you have to start early, which is from childhood, because there's no real way to prevent it when you become an adult. So one of the culture examples is in China. They have implemented a program called Decide into their schools. It's a school intervention that involves the school officials, teachers, parents, and children. And together they collectively try to increase and encourage physical health, and they also implement policies within the school to steer them to improve health. Another one is Australia. The government has funded community-based interventions, and to the right there's a map of how many of these CBIs are actually available in Australia. Both China and Australia show that being able to help obesity within a community is much more effective than solving obesity on the individual level, because as humans we just have a sense of community, and when people experience collective feeling together, it gives them more reassurance. So in order to prevent obesity in adults in the future, is the literature is really telling us that we need to start at a young age. Starting education and prevention at childhood is a really good way of preventing adult obesities. There was a study done in Germany for obesity prevention, and they targeted a community, but within this community they also targeted selective people who were at higher risk or already obese, and they educated them about living a healthy lifestyle by watching what they're eating, and also how they can implement physical activities within their daily lives. This study focuses on family, so with the involvement of family, the study was able to see a decrease in percentages of those being overweight. So my opinion on adult obesity is that the prevention should start at a younger age, and that educating kids is the best way to prevent adult obesity. I think educating kids and telling them why they're eating certain things and why they're doing certain things really sparks an interest in them, because when I used to work with children, we would cook, and the majority of the times we would cook with vegetables. And when you educate kids about what they're eating and what's in it and why it helps them be healthy, they can take this home to their families and also teach their parents. And when they're going grocery shopping, they can, you know, help steer their parents in a healthier direction of what kind of produce or what kind of cereal their family might be buying. This concludes my presentation. Thank you so much for listening.